Okay, it looks like the numbers are stabilizing. Hello, my name is Brian Mellon. I'm the Marketing and Comms Manager here at the Faculty of Medicine. Thank you for joining this webinar about research in the MD. I do have a little bit of a cold, so I apologize for my croaky voice, so I won't talk too much. I will hand it over to the panel so that they can do most of the talking. I'm sure you want to hear from them anyway, more than me. So first of all, I will hand over to Professor Di Eley.
Do you want me to start now or
No, just a quick introduction.
All right, okay. Hello, everyone. I'm Di Eley. I'm the director of MD research at the medical school. So I kind of coordinate everything. So welcome.
Great. Kylie?
Good morning. Well, I guess good afternoon for some people. I'm Kylie Kriener. I am an MD PhD student. I'm in my third year of the PhD. So that means that I go back to medicine next year.
And we've got Annalie as well.
Hi, everybody. My name is Annalie. I'm an MD2 student at UQ-Ochsner, and I'm also part of the Ochsner Phase 1 student board focusing on research.
Great, thank you. And we've also got Irene in the background, so she'll be managing the chat. I know that some offers went out yesterday for our onshore international cohort, so if you got an offer, congratulations. So yeah, let's kick things off. Di Eley, can I hand it back to you to start your presentation?
I'll just share my screen if I'm successful here. Let's just see. Okay. Right. Is that showing correctly?
Nope, it's showing your notes, so you just need to switch the display.
Do that again. Swap.
Every time.
All right. So is that better?
That's perfect.
Okay, everybody. So this is really, I'm just going to go through a few slides and just give you a very broad overview of the research options for you as a medical student in the medical program here at UQ. So I want to start with an acknowledgement of country. The University of Queensland acknowledges the traditional owners and their custodianships of the lands on which we meet today. We pay our respects to their ancestors and their descendants who continue the cultural and spiritual connections to country, and we recognize their valuable contributions to Australian and global society. Right, so I'm going to, just like I said, give you a very broad overview of the Faculty of Medicine. So the Faculty of Medicine has, the School of Medicine is part of the Faculty of Medicine. And these numbers here, I probably need a bit of updating, but they don't change a whole lot from last year. In this, it shows you the number of students. So in the faculty, that including postgrad students, 2,000, undergraduate students, about 600. And I'd like to pay attention to the research icons here. We have research is very, very strong in the Faculty of Medicine and medical school in particular. So there's, it is known as a research intense university. So then that really lends a lot of opportunities to you to do research while you're here. So there's a big variety that you can get involved in. What we do with in the medical school in terms of presenting research opportunities and teaching research in general is really what you would call a translation pipeline. So we try to link the preclinical and clinical sciences with population and global health, because global health and healthcare is probably becoming one of the more important areas of health and medicine across the world. And our programs really encompass biomedical sciences. So we have a School of Biomedical Sciences, and there's the School of Medicine, and importantly, the School of Public Health. So these combined with the medical school to bring you this sort of pipeline of, basic discovery, going into the clinical research, and then really translating through evidence and outcomes. And outcomes are generally, known throughout the community and population. So that's our aim. And just to give you also an idea of the research variety and strengths across the medical school, there are 5 hospital-based research centers, 3 research-intensive schools, and then clinical research across all the hospitals. So this little highlight or diagram here just gives you a little bit of an idea of the different types of research you can get involved in. One of the things that students always ask me is, I'm really interested in this or that. And I just have to sort of say, just wait for it. And, you'll find it somewhere because, you have to realize that a lot of disciplines encompass several disciplines. So, my advice early on is if you're interested in something, don't be too specific early on because you need to open your mind, I guess, or your views to what else is involved in. They're very, very cross-discipline. Most research projects can be. And as I said, there's 5 hospital-based research centers. Now, we've got this this photo here of it's called the Translational Research Institute, or TRI. And as a first-year student and first and second-year student, you'll spend a lot of time here. But this is a huge building, very impressive, and a real delight to, I think, for our students to have this sort of these sort of venues to base yourself as a student, and also to work in research. And there's 5 schools in the School of Medicine. So as I mentioned before, biomedical science, public health. And there we call the Greater Brisbane Clinical School, which if I had a map of Brisbane, you'd see it's quite confusing actually, because we have a river running through the city that meanders all over the place. It's very difficult to get your bearings right when you first arrive, if you're on what side of the river you're on. But there's schools, clinical schools associated with all the hospitals across Brisbane. And then there's a rural clinical school, and this is also distributed across Southeast Queensland. And I don't have a map of that. We should get one of those because that's quite interesting. Our rural clinical school has a very big, very large reach now, from regional areas to more remote areas where you can spend time in clinical practice. And then there's the Ochsner Clinical School, and this is based in New Orleans. And Annalie and Kylie are both Ochsner Clinical Schools, Ochsner Clinical students, and so they can they'll have some information about that. And as I said, that program allows students to work to spend the first 2 years in Brisbane here for your first 2 years of medical training, and then you spend your 3rd and 4th year clinical training back in the US in New Orleans. So the research opportunities as a student, as I said, are really, really broad. That's because UQ is quite intense in terms of its research, and we encourage all our students to participate in research. You'll get research within the curriculum, but there are other options for you. Excuse me. Options for you as well. So this is clinician scientist track is one that you can incorporate a PhD or a master's or MPhil, as we call it here, a Master of Science with your MD. There's also extracurricular research options for you, and there'll be various within across 4 years. And there's also curricular coursework options so things like electives that you can take that are part of your coursework. So there's quite a variety that you can get involved in while you're here. So from week 1, really, in your degree, you'll be exposed to we try to integrate research throughout all your years. But in your first year especially, we try to integrate research in terms of speakers and talking about research in terms of what you're looking at clinically. So there's also a hands-on research, as I mentioned, in the course, and then really the whole theme across all 4 years is to integrate scientific evidence into what you're applying clinically. So I think that, you know, Kylie and Annalee can probably speak to this, you know, depending on their circumstances. So the student research portal, I do want to mention as well, this is a website. And it really is the go-to place for information on student research, especially for the opportunities that you have. And it's about connecting students with supervisors so that you can undertake some research on your own, perhaps while you're here. This is just one. I'm just going to go through a couple of the pages. There's a tile devoted totally to the clinician scientist track, which is the MD PhD or the MD MPhil. This tile here talks about the real clinical schools. And this Ochsner Student Research Hub would be important for you to look at if you're an Ochsner, if you're intending on going to the UQ-Ochsner. And that has some specific information about research opportunities for you there. And then these are just some other tiles you might want to look at, talking about, you know, have a look at this, have a good browse around. There's quite a lot of information on here. And when there's new things that come up, the portal would be your place to go. I just want to say a couple words about the UQ-Ochsner MD PhD scholarship. So this is obviously for students who are entering the UQ-Ochsner program. But if you're interested in combining a PhD with your medical degree, you might look at this. And if you are, I would encourage you to talk to me very early. You don't need to talk to me now, but when you start the program, if you think about it, the earlier you talk to me about what you think you might want to do in terms of incorporating a PhD or an MPhil with your MD degree, the better, because it doesn't happen automatically. There's quite a lot of planning involved and a lot of well, it's another degree that you're actually intercalated with your MD degree. So it's not that straightforward. It's not at all like what you might know of in the United States or elsewhere. We have our own program, and Kylie can tell you a little bit about that because she's an MD PhD student. But there's also details on the program website, which are this tile here on the portal website about an MD PhD scholarship. So that would be worth looking at if you're interested in that. And I'll just finish by saying there's a lot to take advantage of while you're at UQ. There's a lot of high-level research symposiums and events that you can take part in or attend. And all of these things really enrich your experience. If you're interested in research, you really need to keep an eye out for it. Not always, you know, this is a big program with a lot of students. And so you kind of need to be proactive and look for things rather than have somebody say, you know, tap you on the shoulder and tell you what's up. So, you know, I suggest you keep your eye out for things. And there's a lot of opportunities to take advantage of. So that's all I'll say. I think those are my contacts there, and you can feel free to contact me anytime. You know, if you were lucky enough to get a place in medicine, and you want to ask me a question now or something, go ahead. I mean, even though it's August today, so it's August. Time is, you know, it won't be long and you'll be here. So you can contact me anytime. So I'll stop there, I think. Where can I stop sharing? And is that
Great.
it? Okay.
Thank you. And I'll put a link to the research portal in the chat if anyone wants to click on that.
Radio. Thank you.
Yeah, so thank you very much for that, Di. Kylie, can I hand over to you?
Sounds good. Can you guys see my screen okay?
You just need to do the swap same as Di.
Okay. All right.
There you go. Perfect.
Technology. Hi, everyone. My name is Kylie. I am an MD PhD student at UQ. And so I think Di kind of alluded to this before. The way that works is you do your first 2 years of medicine. And then you take a time out from medicine, and then you do 3 years of PhD research. And then after that, you go back to years 3 and 4. So I'm at year 3, and I go to Ochsner next year. So I just wanted to kind of give you an overview of my journey to the MD PhD program. I graduated from the University of Iowa, so go Hawks. I don't know if we have any Hawkeyes out there. And then I went to graduate school in Massachusetts. And then following that, I worked for about 5 years. So I had a pretty non-traditional path to medicine. And while I was working at a hospital, and I decided I really wanted to take the MCAT and try to get into medicine. And I had quite a bit of research experience, actually. All 4 years when I was at Iowa, I worked in a cell biology and anatomy lab. So I did a lot of like molecular biology techniques, did some histology, and some cell culture. But then when I went to graduate school, I did a bit of a pivot and did more public health research. I did quite a bit of qualitative stuff as well as survey. And it was different, but it was really good to have the 2 different experiences. So then while I was in the MD, I kind of always knew I wanted to do a PhD, but I think like there's always that fear of failure that kind of holds you back sometimes. But around year 2, I actually went to the research portal and I found a project that I found to be absolutely perfect. It married my engineering degree with surgery. So I'm interested in surgery. So I would highly encourage you to check out the research portal. There's so many amazing projects there. But yeah, so now I'm in Brisbane working on my PhD. And everyone has a very unique PhD journey and MD journey for that matter. And what I kind of wanted to emphasize, even with the MD, life doesn't have to stop. Like you can have fun experiences. Like I have gone diving. The Great Barrier Reef is very close to where we're at. So it's really cool to, go do some diving. I've done some running, some hiking. But with the PhD, I've also been really fortunate because I've won a grant, or my PI has won a grant or an award. And so every 6 months, because it's a global grant, we get to travel. And so we go to these PI meetings, which has been really fun. So we've been to Amsterdam, the UK. I've been to the US 3 times, and I've been to New Zealand. So again, like whatever you choose to do, there's a lot of opportunities. And I've also, some people have asked me, I am interested in the MD PhD, but I want to start a family, or, I'm old. And I just want to emphasize as well that like, you're going to be, if you're not already 30 or 40 someday, so you might as well just do what you enjoy now, because there's no time like the present. And I actually had my daughter shortly after I finished my first year in the PhD. So it's incredibly difficult, but it is doable. And so I kind of wanted to share some of my research with you guys, just so you can see the types of projects that are out there. So my research focuses on making surgical training more efficient and essentially safer by trying to improve physical mimics. So if you think about it, when you become a doctor, the first time you do a procedure is going to probably be on a patient. There's not really a way around that, right? So we're hoping to make some physical mimics where you can practice doing certain procedures, and then, you have that practice before you go into the clinical environment. So one of the things we've been doing is we've been testing the human tissues and trying to get some of their mechanical properties. So here just shows a tensile test with some muscle. And then we tried to find synthetic materials that kind of emulate the properties of tissue. And we've designed this synthetic mimic. So this is a mimic of an abdominal wall. The procedure that I'm studying is for laparoscopic surgery. So some of you might be familiar with laparoscopic surgery. If you're not, what it is it's a minimally invasive type of surgery. So they stick, it's called a port because it's literally a port between the outside world and the inside world. So you stick your instruments through these ports and a camera through these ports, but there's no training on how to put the ports into a patient. And so that's what we've been working on. And the abdominal wall is actually a really complex anatomical structure. It's got a lot of layers. And so the layers are what surgeons feel when they're placing a trocar, and it tells the surgeon where the trocar is. So then after we've developed these mimics, we've been working on, okay, well, does this mimic actually replicate the puncture force of a trocar? So we've been working with the UQ mechatronics team, and they built us this customized robot. So you can automatically put a trocar into either cadaveric tissue or the synthetic tissue. So this video here just shows our little robot in action. This is the trocar here. And the why we did that is because acceleration affects force. And so you can't tell a person to not accelerate, but a robot can do linear motion at a controlled rate. So I also wanted to share this next video. So this is us testing on some synthetic material, but we have to compare it to real tissue if we can to see how these forces compare. And so this GIF here is just showing what it looks like from the internal view of a trocar entering an abdominal wall. And then, of course, so Di talked about translation, and this is the translational part of our research. So in these mimics, like, you can have all of the quantitative data that matches as you want, but really at the end of the day, it's perception and the qualitative data that really tells us if these mimics are good. So we've started we started measuring surface EMG as well as joint angles and getting qualitative feedback from surgeons. And so this data just these images just show like what our data looks like, some of the things we're trying to capture. So this is from a surgeon here, and when they activate certain muscle groups, when they're placing a port in a cadaver, and then we're going to compare that with our mimics just to, see if the biomechanics change, and then as well as get that qualitative feedback. So we've had some really promising feedback. And then another element of my PhD is are these mimics even efficient for learning, especially with motor skills? So this is like one of the graphs that I'm most proud of. If anyone knows ROC curves, there's a minor error, but I'm not going to point it out. So what we've done is we've asked surgeons, medical students, residents to stretch some material and tell us if it's stiffer, less stiff, or the same as a reference material. And so we get these curves, and what this is showing is the more area under the curve is basically anyone from that group is more likely to correctly match tensile properties. So like this material is stiffer than the reference, or it's less stiff. And what I think is really cool is it's correlated with experience. So this really tiny sliver is med students. And so there's not a lot of area under the curve. But when you go from a med student to doctors with 1 to 5 years of experience, that area starts to increase. And then finally, doctors with greater than 5 years of experience, they've got like much better abilities to like discern between the mechanical properties of some synthetics. So I think that's really cool. That's one of my favorite graphs that I've generated so far. But yeah, I hope some of that information is interesting. Again, it just kind of shows what's out there. Yeah, so if you have any questions, feel free to reach out.
Great, thank you very much. That is quite interesting. I did have a question, if we can. So you are heading back to the MD next year. What are you doing to prepare yourself for entering the program again?
Stress. Just kidding. Yeah, so one of the things that I've tried to do is there's quite a few a few groups on campus. So one of them is called SWIM. It's basically supporting women in medicine is what it stands for. And they have these clinical refreshers every so often for first and second year medical students. And so I've been tutoring those so then I can kind of get back into the physical exam and start thinking about, you know, how to properly do a physical exam and, you know, what am I looking for? So that's one thing. And then I think UQ is also going to try to put on like a mini course before I go back where they do some refreshers for clinical knowledge. So it's always a balance, but there's support, so that's helpful.
Great, thank you very much. Annalie, over to you.
Perfect. Okay, let me share my screen. Did that look okay to everybody?
Yep, that looks good.
Awesome. So I'm Annalie. I'm a second year student through the Ochsner program. So I'm coming to the end of my time here in Australia, but it's been a really great journey. So I thought I would just start by talking about my journey into medicine. It actually has not been a really linear path for me either. I was pretty set on going to law school at the pre-health major as well. I really interested in health equity and in public health, and wasn't sure exactly how I wanted to approach those types of issues, whether it was more from the political side of things or more from the medical side of things. But as I progressed through my degree, I realized that I really valued clinical experiences, and I got involved in research and actually did a thesis looking at the initiation of a trauma-informed group therapy model. And that was really impactful for me. It was something I felt really passionately about. And so I decided to kind of pursue medicine more and ended up doing a research fellowship at Yale, looking at health equity through a different lens through clinical research in pediatric and neonatology. And then after that, decided to come to Ochsner, and it has been an amazing experience, and I highly recommend it. It can definitely feel a little bit daunting to think about moving to a new country, but Brisbane has been fantastic. People are so welcoming, and it has been a really great way to learn about a different healthcare system as well. So yeah. Have been able to get involved with a lot of different types of research here, which has been really great. My background prior to this was I had done some research in undergrad in medical anthropology, and then my thesis, which was more political science, interdisciplinary, and then a little bit of clinical research. But since being at Ochsner, I've been able to explore a lot of different types of research. Since being at UQ, I've been able to explore a lot of different types of research as well. So the first project that I was able to get involved in was a project looking at a survey project trying to look at factors influencing medical student well-being. And so it was a really great way for me to upskill in that area because I wasn't really familiar with too much about statistics or survey research, and was really felt supported by the other students and staff in joining that team and learning in that way. So the picture on the right side of the screen of me with a research poster is one of the outputs from that project, and I was able to present it at a conference last year, which was a really awesome experience. In keeping with my interest in health equity, I was able to get involved with a research project looking at diabetes and people experiencing homelessness, and that has been really awesome too because it allows me to connect more with Brisbane and the local community, and to really pursue that interest in health equity. And so that project is still ongoing, and it's been really cool to get to be part of it. UQ also provided a lot of support in helping me upskill with my systematic review skills. We got some classes and learned a lot about how to conduct a systematic review. So I was actually able to get involved with that type of project as well, and completed a systematic review looking at benzodiazepine misuse in elderly people living in aged care facilities here in Australia. And then the final project that I was able to get involved in is there on the left. Through the UQ-Ochsner program, I was able to become part of the STARS Fellowship, which is a fellowship focused on high-value healthcare and making decisions for patients that prioritize financial literacy and comprehensive healthcare, holistic healthcare. So Ochsner has a certain amount of fellows each year who are part of this program. And through that fellowship, you are able to go to a lot of educational events and just learn about how to make choices in treatment and testing and procedures that are best for your patient on a holistic level, not just medically, but also taking into account social factors and financial factors as well. And so that's been a really awesome experience, and I'm really grateful for that. Yeah, so there's a lot of different ways that you can get involved in research at UQ. And if you're an Ochsner student, there's also a lot of ways that you can get involved with research through Ochsner. And definitely whatever your interests were before starting medical school, you can bring that in with you. And I think that it's a really big strength to be able to weave those passions together and kind of come at it from an interdisciplinary perspective. But yeah, and there are lots of different supports. There are other students who are involved in research, and a lot of opportunities to get involved in all kinds of different projects. So it definitely is self-motivated. Whatever you're interested in, you can kind of pursue. But yeah. And then the last slide I have is just similar to what Kylie was saying. I think one of the greatest strengths of this program is that we have a lot of opportunity for balance. You get to live in Australia and experience all kinds of new fun things. So I just put some pictures in. These are from the last year and a half of just things that I've done when I'm not at a research lab or in the library. And so yeah, it's all about balance and finding the things that bring you joy, because it is a long road. But yeah, if you have any questions, please feel free to reach out.
Great, thank you very much. There are a couple of questions in the chat. Di, I think the first one is going to be for you. Just asking whether research can be conducted across faculty.
Is that in the chat?
Yep, from Kenneth.
Kenneth. Okay, I was reading that. I didn't read it. I guess I didn't read down far enough. Because that's a really good question. Yes, you definitely can. And we encourage that, actually. And like I was saying, research crosses crosses all disciplines. So, don't be too specific, I would suggest early on. And I think Kylie and Annalee really demonstrated that perfectly on the different, specialties and different, they would be different schools, in fact, that you could get involved in: engineering, psychology, and definitely public health. And also the, you also expose yourself to different methodologies. Like and both Annalee and Kylie mentioned things like, surveys and interviews and things like that. It's not just lab work. In fact, it's quite difficult to do any basic research in a lab while you're doing your degree, unless you are intercalating a research degree like Kylie is, because anything that's very time critical, you really have to understand you are here to do your medical degree. So let's just keep that in mind. And we do want you to keep, to be exposed to research and take research opportunities, but you do have to prioritize that medical degree. And it's, you can do that, but you do have to make some choices. So we really advise students not to get involved in anything, any research that's time critical, like, you have to go feed a mouse, or you have to take consent patients, things like that. Unless you can arrange to do those and at weekends or something, might be possible, but there's many other types of research that you can get involved in that are more flexible, and those are the best things to choose to get started. But yes, across all faculties is absolutely fine and encouraged.
Great, thank you. Kylie, there's a question from Zane for you. What are your plans to continue to expand your research?
Yeah, so this is a discussion my PI and I have frequently been having. So ultimately what we're trying to do is design like a framework for, making simulations that feel more realistic. So I do know like my PI would like to expand to like chest tubes or central venous line placement. So my personal involvement will probably be a little bit tenuous for a while, just because going back into the clinical environment, like I'll have, as Di mentioned, you have to focus on your MD, your medical degree. But I'm sure like there'll be continued discussions and work in that area. And then his second question as well was asked if you think training med students to discern different elements is beneficial for practicing procedures. And so yes, I think that comes down to how we educate. So at the moment when you're training, it's mostly about volume. There is a balance with that, in that you don't want something to be super duper realistic, because that turns out there's been some research where that actually has negative effects. But if you start to kind of break down a procedure and what are the important elements. So when you're placing a trocar, it's that pop in the fascial tissues. So if you can start to teach those relative differences, like, oh, you're going to experience a lot of resistance as you're hitting the first layer of fascia. Oh, there's less resistance at the muscle layer. I think that actually could improve education a lot. Yeah, so hopefully that answers your question.
Thank you. Di, question for you. How receptive are PIs in supporting students' research before they graduate a medical school? Achieving a publication, sorry.
It helps to unmute. It's another really good question, and I mean, Annalee might be able to comment on this. I think, again, I would caution anyone that wants to do research when they're starting, like first day of medical school, just take your time, because one of the most important things that you really need to keep in mind if you're choosing to do some research is who you're working with. Kylie's, shaking her head. And I mean, I've been through it as well. Your supervisors and your team, the people that are going to help you, and that, that they agree to give you a project that you can work on with them. It's really important that you feel comfortable with them, and that they understand what you want and you understand what they want. So it's time to really be bold and have discussions with people, go up to researchers or to tutors. If you go into class, talk to them, go to class, I mean, a lot of things are on Zoom now, and that's just the way things are. But the more you can talk to people and even reach out through an email, and then maybe follow it up with a meeting, because I will say this to anyone, the researchers, vast majority of researchers, and I know a lot across UQ on many disciplines and many research institutes, are very generous with students in terms of allowing them to be on papers, to give presentations, to go to conferences. Now, not every student's going to be doing that, but if you're interested in research, those are some of the opportunities that you'll have. And Annalee has mentioned that, and just as a student, and obviously Kylie's in a different position because she's actually doing a PhD, and she's just done wonderful things with the time that she's had. But that's different than being just a medical student and doing some research on the side, which is, I think, what most of you will be thinking about, at least initially. So just be very careful to be clear. And, I know that and it's perfectly reasonable to understand that you will want to benefit from some publications, being on a paper, being on a presentation, and just getting mentioned, or, get some recognition from what you do. But it's not an expectation that you should come in with. You have to earn that, and you have to be clear with whoever you're working with how you're going to earn that. So generally, as I say, though, most of the researchers that I know a lot over many years, they're very generous, and they really, really value medical students. They like having medical students because you ask good questions, and you're always asking questions, and you're eager and keen. So, I think that that's a really important point to keep in mind. And Annalee, in your experience, do you have anything to add to that?
Yeah, I will say I think that yeah, there are definitely a lot of opportunities. I agree with what you said about taking the initiative there and going after them. If you are somebody who is interested in research, there's no reason why you shouldn't be able to find a PI. People at UQ are really open to working with medical students. In fact, I think it's even easier than at my undergrad or during my fellowship. I think that there are more people who are willing to work with you because a lot of Australian medical students don't really get involved in research until later on. So if you're motivated, there are plenty of opportunities to do that. Also, in terms of publications, I think that having those conversations early on and being clear and setting those expectations is a great thing to do. I've just been doing research on this side, and it's only been 2 years, like a year and a half, and I already have 2 papers that are in for in the publication process. And so I think it really is just what you make of it.
Right. And Kylie, you'd like to add to that?
Yeah, I think Di had a lot of really good points, and I'm in a unique position because I've seen it as a student, but I've also had students come in and help me. So the first thing is like communication is key. The supervisor absolutely makes or breaks your experience, as does the individual in the project, but having open, clear communication and just just general rules of being respectful. Like, if you're really busy some week, just be very open about that. And I would highly encourage you not to try to do research your first semester of the MD. You really need to get an idea of what the time commitments are, because you can be like the smartest, book smart person, but like the MD is such a different beast, especially that first semester. So once you have like a better grip on that, then start to think about research and looking into projects that interest you. So like some people have asked me about how to approach researchers, like have a CV ready, go meet them in person. My best experience has always been networking in person. Cold emailing works, but if they're a clinician, they're really not always great at responding. Academics will remember you if they see you, if you express interest. So yeah, I just wanted to really hit home on some of those points that Di made, because they're really important points.
Yeah, thank you both. And I will reiterate again, yes, communication. And just be clear, but also, think about what you're saying and make sure that you can commit to it, or you can actually finish what you commit. The only problem I've ever had with, and it's been very, very few over many years, is students who say they're going to do something and then they just disappear. That is the most disrespectful thing you can do, because think about it, when somebody doesn't answer your email, even if it's a friend, you're thinking, what's going on? But, you're asking somebody to help you. You've agreed to do something. It's fine to say, look, I've misjudged, or I'm busy for the next month. That's absolutely fine. But if you don't say that, it's not good at all. And, I don't fancy your chances to do any more work with that person, or maybe others, because they were going to talk about the student who just didn't talk to them and just disappeared. So don't do that. Just be open and clear with people. So thanks.
Great, thank you. Great advice. There is a question which you kind of answered already. It's what is a reasonable amount of research for a good work-life balance? Ugh. Who wants to tackle that one first? Annalie?
I'm not going to tackle it. I've been there. I've done that.
Yeah, sure. I think the as Di and Kylie are both saying, I think the priority is, of course, focusing on your classwork and making sure that you're doing all the things that you need to do to be a good clinician and a safe clinician. So putting that first. Um, Definitely get your sea legs. Medical school is different to any other kind of school. But once you've done that, I think it really depends on what you prioritize. If you're somebody who researches is it matters to you and it makes you feel more connected to the reasons why you want to be in medicine or why you want to be pursuing those questions, you might spend more time and feel more rejuvenated from doing more research versus if you're somebody who there are lots of different ways that you can, find that rest and connection to self. So it really just depends on you as a person and what you value and what brings you joy.
Thank you. Kylie, anything to add?
Yeah, I feel like, so again, it depends on the student, depends on the supervisor and the project, but always think quality over quantity. Like, I would rather have 2 really great papers than 15 meh papers. And are you accomplishing the goals of your research too? Yeah.
Yeah, I think I agree with what's said there because and it's up to you. Everybody has their own measure of what their balance is. But if you're going to have a career in medicine, whether that's academic, that includes maybe teaching and research and clinical or purely clinical, you've got to make the decision on what's really important. And early on, you're going to think, oh, if I can only get 5 papers, then I can, I think a lot of students are very specialty driven early on. And I understand that completely. That's a really important thing to think about. But you also have to realize that you're not going to change your mind too. So just be a bit more open. But don't be so prescriptive. I think that, other people telling you, oh, you're going to have 4 or 5 publications. They got to be first author. No, I don't think so. There's no rules. There's no rules like that. People will have strong opinions. And that's fine, but you need to think about, and it's difficult because, you're influenced, you're wondering, what's the best thing to do. You want to take good advice and there'll be some good advice you're giving, but it might not fit for you. So it's time to start thinking about what you want and you don't need to do that right away. It'll take a while, but quality over quantity in medicine or science is always a number one. And that goes for research, pure research, public health research, clinical research, whatever. I mean, that's what it's about. Yeah, so it's just something you'll figure it out, but don't worry, don't try to rush it, I guess.
Thank you. Annalie, I think this question is for you from Nash. Opportunities to explore research in health equity and economics of medicine. Am I correct saying that you're probably the most appropriate person to answer this question?
Yeah, sure, I can give it a try.
Thanks.
So UQ is great because there are a lot of different faculties that other than medicine that are open to working with medical students. As somebody who's really interested in health equity, I kind of deep dove into it last year and found that for my interest, the School of Public Health was the best aligning faculty. But UQ is great because a lot of there's a focus on kind of interdisciplinary studies. So some of the coursework that you have is about social determinants of health or economic determinants of health as well. So a great place to start would be connecting with people who give those lectures and seeing if they have any recommendations for who to work with. But there are definitely a lot of opportunities to get involved in health equity. Brisbane is a great place to be too, just in the general community. There are a lot of different hospitals in the area who receive government funding to do work in the health equity space. And those research projects are also looking for people to be involved. So even outside of like the more academic setting, there's community-based settings as well where you can get involved in that type of work. So yeah, it's a great place to be.
Great, thank you. Kylie, did you have anything to add on that one?
think Annalie did a fantastic
Yeah.
job answering that. Yeah.
Perfect. There's another question from Kenneth. If you guys want to have a read of that one. So basically, Di, I think it might be for you. So what is UQ's take on negative reporting or inconclusive? Do you want to take that one?
Yeah, I'll take that one. I think somebody's been reading the recent papers lately. There's actually journals now on negative results, the Journal of Negative Results. I don't know, this is really it's an interesting question. I wouldn't be able to comment on UQ's take on that. I think it's a much more broader discussion, really. And I think everybody would have their own take on that. I think it gets back, personally, I think it gets back to quality. I mean, research is about getting and answering your question. And sometimes, you know, if it's a strong research question that needs a hypothesis, you know, whether you prove or disprove that hypothesis is the answer. That's, if you've done a good job, that's your answer. So sometimes negative results, that's your result. That doesn't, because they're negative from what you hypothesize, doesn't mean they're bad results. That's information. And research is all about just creating information. But again, it's got to be quality information and undertaken in the best quality research as possible. So you're getting back to quality. But negative reporting, I'm all for it myself. You learn. You've learned something. Now, research is knowledge. So you've learned something. To me, that's fine. And you don't hide it away. I think there's something bad about, you know, well, we didn't get what we wanted, so we won't report that. Why? If you've done it well, you've told me something. You told me what you've done doesn't work. That's helpful. So, you know, I think it's a very theoretical. We should talk about this over a coffee sometime. That's what somebody would say to me. So hold that thought.
Thank you. Another question, I think we've kind of answered it already. What support do medical students get to get published? Support.
Well, I mean, I'll say, right, I'll refer to my previous answer in terms of you're talking to your supervisor about that, but maybe Annalie and Kylie can probably give you a bit more insight on their experience.
So for me, it depends what you mean by support. I had, you know, my supervisor like review my manuscript, and when it comes to like publishing fees and stuff, we had the grant award to pay for that. But the UQ library does have agreements with some journals where you don't have to pay a publishing fee. So if the support is in terms of, you know, financial support, there's that. And if it's in terms of writing, I always ask my medical students, like, how involved do you want to be in the process? Like, I still make them meet the qualifications for authorship, but like, you know, do you want feedback on your writing? Do you want to look more at the data analysis side? So it really depends on who you're working with and what support you want.
Yeah, that's good that you mentioned that, Kylie. I wasn't thinking of support in that way. A lot of a big question, and rightly so, on everybody's mind is paying for publication. And it's a real problem, to be honest, because, you know, journals have changed, publication, the world has changed a lot very recently. And personally, I'm disappointed because it's all the money's going to big publishers, but that's another story. But it is difficult and it's expensive. UQ in general will not pay publication charges for students or staff. So that's a given. I mean, I get, you know, researchers asking me, you know, will the faculty pay for publication? They don't do it for anyone. And so, you know, that's just not going to happen. But you're right, Kylie, the library it's worth checking with the library because they have institutional collaborations with certain journals, and it's worth checking on that. You'll either get a discount or sometimes it's free. There's still a lot of journals around that are not, that you don't have to pay to publish. So, you might check out those, again, you want a quality journal, but it's got to fit what you're doing. So if that was your question, and in terms of support for the writing, I agree completely with Kylie. You should have a discussion with your supervisor and how involved you want to be. But I think you'll find that if they think there's a paper coming out of it, they're going to be interested in what to, do. So they'll help you along, and I mean, make sure that you're supported in that. So I don't think that's a problem. So sorry if I misunderstood, but.
Great, thank you very much. And Kenneth is very keen to have a coffee catch up.
Oh, well, there we go.
So we are coming to the end of the webinar, so I might do a little whip around and ask each of you what final words of advice you would give to those students coming into the MD. Annalie, can I start with you?
Yes. Well, yeah, it's just such an exciting experience. So my biggest piece of advice would be to come into the experience with an open mind and an open heart, and just really be ready to experience all of the new things and the wonderful things about Brisbane, and the things that might be a little bit uncomfortable at first as you get acclimated. It definitely is a process, moving to a new country and starting medical school. It's a lot of change in a short period of time. But if you stick with it, there are so many things to love about the program and about the city. So that's my biggest piece of advice.
Thank you. Kylie?
Yeah, I agree with what Annalise said as well. Also, don't rush through it. Like, enjoy it. Take your time. Like, comparison is the thief of joy. So do what makes you feel happy, because at the end of the day, you're the one who has to live with yourself. So make time to do the things you love. If that's research, that's awesome. Get involved. But yeah, do some hobbies and enjoy the process.
Thank you. And lucky last Di?
Well, I can't add much more to that excellent advice from Kylie and Annalie. But again, I would reiterate to, get your bearings, take your time, accept that you'd be overwhelmed, because you probably will be. And, just try and get your priorities right. And don't have too many priorities, because I like that comparison is the thief of joy. Yeah, you're going to be now in a cohort of students that are a lot like you. They're going to be all really smart, and they're going to be all really keen. So, don't compare. You're unique, and you're all, in your own way. So just accept that and just do the best you can. But don't rush things. I like that. Don't rush things. You've got a lot of time, actually. You never know. Maybe that delay is giving you a new opportunity. So don't worry, don't overthink. I like to say overthink, and I overthink all the time. So don't do as I say, just keep it in mind.
Well, thank you very much, everyone, for giving up your time. Thank you to the attendees for all their questions, and those who got offers. Congratulations. We're looking forward to seeing you in Brisbane early next year. Yes, thank you very much, and enjoy the rest of your day or evening. Bye.
Thanks, everyone. Good luck.